Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we are going to discuss how to measure the shoulder joint range of motion. The very basic principle is to have an idea about the bony landmarks that we are going to use. So, the subject is positioned in supine and we have marked three areas. Number one, this is the acromion. This will act as a fulcrum. The mid of the humerus is going to act as the moving arm, and the mid of the thoracic or the mid of the ribs is going to act as the stationary arm. Now, first of all, we need to explain all the procedure to the patient, and we can demonstrate the passive range of motion first. For example, all the way up and all the way down. So this is the position for shoulder flexion range of motion. Now we need to place the goniometer. As you can see, I have a goniometer and this is the moving arm and this is the stationary arm. Now the fulcrum should be over here. Now the fixed arm, it should coincide with that ribs or the marks on the ribs, and lastly it should be the moving arm that should be placed with the humerus. Now over here, this is almost the position or starting position. Now we need to measure what is the angle right now. So if you look at this line, this is the line that is over there. So when we are going to measure this, it is about 12 degrees. So we should not include this 12 degrees right now. And now as soon as he moves, we will start from this 12 degrees, then we will come to 0, and then we will keep on going all the way to 180 or whatsoever. So this is the position. I repeat, the moving arm should be fixed with the humerus. The fulcrum or the pivot should be clear and it should be placed just adjacent to the acromion, and this is the fixed arm. So almost the 12 degrees. This is the position. Now this is the starting position. We will ask the patient to perform active flexion range of motion. Now you can see that we need to again position the goniometer over here, and we will try to position it close to the acromion and over here. Now we have from here, we have all the way to this point. We need to measure the ranges. For example, in this particular case, from here it is 90, 100, 110, 120, 130, 140, 150, 156 plus 12, that makes 168 degrees of shoulder flexion. This is shoulder flexion, that is active, and this is 168 degrees of shoulder flexion. Why I said this, if you can see, let me show you clearly. The server, you can move, you can sit. Now please have a look at this goniometer first. That would be more accurate. Okay, so the starting position for our patient was about this, which in this case, if you can see, is minus 12 degree. So if he has moved from here all the way up and to that particular point, we need to add the 12 and the remaining, and it will give us the accurate range of motion. For the extension of the shoulder, we need to ask our subject to lie prone, upside down, and move a bit over here. Yes, thank you. And now we need to explain the procedure that he has to perform this movement of extension. This is the passive movement that I am performing, but when he is going to perform it, we are going to measure the active range of motion. So again, the landmarks will be acromion, we need to place certain dots or points so that we don't miss the actual points. This is very important. So this is roughly the acromion, the midpoint. Similarly, we can measure or take this as that, the central point, and if he is going to relax, let's relax. So let's take this as the midpoint. Now we have again 3 marks. So for the starting position, we are going to measure what is the actual range. Now this, and this is the moving arm, it should move with the humerus. If you can see this, first of all, second, and almost third. Now I want to show you what I meant, because this goniometer is attached in a way that the moving arm is a bit different, like this for example. This is the correct side. So you see, because this is on the inner side, we have to adjust accordingly. So it has to be aligned like this. Let me correct it, and over here, and similarly over here. This is almost minus 12 degrees again in the neutral position, and now I will request him to elevate. As soon as he is going to elevate, please elevate the maximum. I will try to maintain this. This arm should move all the way up and to this particular point. Okay, relax. So 12 plus 10 and 10, 20 and 30 and 36 plus 12 means 48 degrees. So this is about 48 degrees of shoulder extension. That's how you measure the shoulder extension range of motion. Can you please go supine? For the shoulder abduction range of motion, there are various ways, but let me tell you the very easiest way. I would request you to please sit. Yes, please sit. And now we need to adjust the camera. Can you lift your arm all the way up from the side? Okay. So there are various ways, but I'm going to show you the most easiest one, because this is the moving arm. So you can see this arm is moving. We can place the goniometer like this. It is called, can you face that camera please? From the mid position, this is the starting position. So here it is the 0 degrees, and from this position we can either move with our patient, and we are going to measure the range. So we started, thank you. So we started from 90 degree, and it is almost 175 degrees of shoulder abduction. So you can see again all the way 175 degrees of shoulder abduction, and we measured it in the sitting position. Now for adduction, this is the movement of adduction that he is going to perform. We demonstrated the movement, and we can measure this in the supine as well as in the sitting position. So see what is going on. The arm is moving inward, so this is the movement. So we need to start by placing the goniometer over here into the neutral position. This is almost 0 degree, and from here when he is going to perform this, it's about 35 degrees of shoulder adduction. Now the last movement that we need to measure is the movement of internal and external rotation. For that, we request our patients or subjects to position their arm into abduction 90 degrees, and the olecranon is going to act as the pivot, and this is the internal rotation and this is the external rotation. So this is the neutral position. So we will perform this in front of you. So can you please sit so that your arm is like this? Turn. Yes. Here you can see this is almost 90 degree of abduction. One point or one mark is fixed, that is the mid part of the ribs, and this is the fulcrum. Now the moving arm, we can set the moving arm to this position. We can place it in 0 degrees, and from here if we try to go for external rotation, it is about 68 degrees, and from the 0 position when we try to go into internal rotation, it's about 90 degrees. So that's how you are going to measure. Thank you very much. That's how you are going to measure the shoulder range of motion, or you need to perform the shoulder goniometry. Follow the steps and follow the guidelines. I believe you like this video. If you have any questions and comments, do let me know. But please, there's one tip, one advice for all of you, and that is to get familiar with the range of motion, to get familiar with the instrument that you're using. For example, a goniometer. If you are going to spend some time reading more about the goniometer or reading more about the degrees, it will become a lot easy. One other method is that you can use an inclinometer. Nowadays you can also use gyroscopes, or sometimes referred to as gyroscopes or motion sensors, and even you can use your mobile phone. Another way is to measure the range of motion using certain softwares, sometimes cinematography, sometimes pictures, so on and so forth. But the goniometer is the simplest one, it's the cheapest one, and it works for all. There are a lot of sizes, a lot of shapes, and a lot of configurations available. There are certain goniometers that have a lot of attachments, and let me, before we really finish this video, let me show you one. Hold on for a second, and I am, see, I'm talking about this goniometer. This is a very advanced goniometer. You see, you can measure this angle, you can measure this angle, and again this can act as a fixed point. So you can place it like this also, for example, onto the hip or onto any other joint. In some video I'm going to show you how you can use this, but for now I think that's enough. If you have any questions and comments, do let me know. Thank you very much.